welcome to the RCORP Lecture Series on working with vulnerable populations. In this video, we will discuss the intersection of cultural backgrounds in the clinical setting. In this video on addressing cultural issues in the clinical setting, we will discuss the intersection of roles and expectations, specific skills, and provide examples as well as additional resources. In the clinical setting, people have culturally informed expectations of what care should look like, and this can vary by group as well as between individuals. For example, some Asian clients prefer a more didactic therapeutic approach, where the clinician is seen as the expert and is expected to impart specific information and advice. In such a situation, it has been recommended that clinicians establish credibility early in the relationship by presenting their level of education and professional experience. Clients with this therapeutic orientation often prefer formal titles such as doctor over less formal approaches such as using the clinician's first name. People from other cultural groups can prefer a less formal therapeutic style, where they are more likely to see the clinician as an extended part of their community who fills a role similar to others, including extended family and kin, as well as healers and spiritual leaders. Mary Gold is a 56-year-old woman who immigrated to the U.S. from Colombia when she was 25. She presents with general sadness and motivational issues that are consistent with depression. During the session, Mary Gold states that the clinician reminds her of her daughter and uses terms of endearment. She also expresses interest in the clinician's life, including questions about her nationality, marital status, and holiday plans. Some issues include maintaining clinical frame and keeping focus on the client's needs. This means that while we do not wish to dismiss our client's interest in us, we do need to center the limited time to the needs of the client. Some solutions include providing education on the role and structure of therapy, as well as expressing curiosity by exploring with the client what it might mean for her if she were to learn specific details about the clinician's personal life. During this process, it's also important to remain flexible while navigating between the requirements of therapy and the client's expressed need to know more about the clinician. Here are some skills we can use to help with the process we just reviewed. Though we should generally always provide an overview of the treatment process with new clients, this can be particularly beneficial when working with clients from backgrounds different from our own. This includes discussing the roles of the clinician and the client during therapy and what this might look like. Though clients may ask us personal questions while becoming oriented to the clinical setting, the use of curiosity can help us reorient the conversation to the boundaries of the setting as well as to the needs of the client. As described in the last slide, we can explore with the client what it might mean for them if they learned the answers. Lastly, we will want to adapt the session and structure to the needs of the client. This will include exploring the client's treatment needs and goals, and then discussing how the therapeutic process will meet their needs. Cultural backgrounds can come in many forms, including race, ethnicity, linguistic experience, and immigration status, but also rural versus urban, economic and educational status, spiritual and religious adherence, veteran status, and more. Other areas in which cultural backgrounds can present in the clinical setting is via gift giving and physical contact. In both cases, a good rule of thumb is to first check the rules and policies of your institution, which can be referenced as situations arise. For example, many agencies have a monetary limit of $25 or $50 that a clinician can accept as a gift. It's also important for clinicians to be aware of their personal limits for gifts to avoid being caught off guard or feeling indecisive in such situations. In some instances, accepting a gift might help the therapeutic rapport. For example, a client might give a gift of a paperweight, which the clinician regularly uses in their office where the client can see it during sessions. The issue of physical contact can vary slightly depending on context, but as a rule, the American Psychological Association states that it must be appropriate, ethical, and not for exploitation. It should be for the client's needs and not the clinician's. For example, for some, this might include a hug at the end of treatment when the client has met their goals. Some skills we can utilize as clinicians include consultation and self-education. Clinicians often have expertise in different areas, including cultural competencies. Consultation with such experts can be a valuable resource for clinicians. We can also search for resources on working with specific populations, such as the resource to the right. Here are some additional resources.